Imagine this. You're going about your day, maybe relaxing at home or driving in your car, when suddenly something feels off. Your chest tightens, your breathing becomes very short, and you start to feel dizzy. It hits you. This could be a heart attack. But you're alone. No one is there to call for help or guide you through what to do next. Did you know that heart attacks are the leading cause of death worldwide, claiming over 17.9 million lives each year? Many of these individuals didn't realize they were experiencing heart trouble until it was too late. It's a terrifying thought, isn't it? The idea of experiencing something as serious as a heart attack without immediate assistance can be overwhelming. But here's the thing. Knowing exactly what to do in this situation could mean the difference between life and death. In this video, we're going to cover everything you need to know about surviving a heart attack when you're alone. By the end of this, you'll know how to recognize the signs of a heart attack and the exact clear steps you need to take to save your own life. We'll also reveal the single most critical mistake people make during a heart attack that can cost them their life. Stay tuned to learn how to avoid it. So, without any further ado, let's get started. Number 1. Recognizing the signs of a heart attack. Before you can take any action, you need to recognize what's happening. A heart attack doesn't always present with the dramatic symptoms you see in movies, like clutching your chest and falling to the ground. In fact, the signs can be subtle and vary from person to person. For many, it starts with discomfort or pressure in the chest. This can feel like someone is squeezing your chest or placing a heavy weight on it. The pain might radiate to other areas, like your arms, back, neck, or jaw. Some people also experience shortness of breath, even without chest pain. Nausea, lightheadedness, or breaking out in a cold sweat are other common symptoms. For women especially, the signs can be different and more subtle. Women often experience more nausea, vomiting, and back or jaw pain, sometimes without the classic chest pain. Don't ignore these signs just because they don't match what you've seen on TV. It's very important here to act quickly because time is critical during a heart attack. The sooner you recognize the signs, the sooner you can start taking steps to protect yourself. Many people hesitate, thinking the symptoms might go away or that they're overreacting. This delay can be dangerous. If you're alone and suspect a heart attack, don't waste time convincing yourself it's nothing. Acknowledge the signs and start acting immediately. Number 2. Stay calm and control your breathing. The first thing to do when you realize you might be having a heart attack is to stay as calm as possible. This might sound easier said than done, but panicking can make things worse by increasing your heart rate and putting additional strain on your heart. Take a moment to focus on your breathing. Breathe in slowly through your nose and exhale gently through your mouth. This can help steady your nerves and keep your body from going into full panic mode. Number 3. Call emergency services immediately. Once you've calmed yourself slightly, the next step is to call emergency services. In the United States, dial 911 or the equivalent number in your country. Even if you feel unsure, it's better to make the call and explain your symptoms. Even if you can't talk, leave the line open. They can trace your location. Put the phone on speaker and set it down nearby in case you lose consciousness. If you have a smartwatch or a medical alert device, use it to notify emergency contacts or send an alert to nearby responders. These devices can be life-saving when you're unable to speak or need immediate assistance. If you're driving, pull over immediately and stop the car. Don't attempt to drive yourself to the hospital, as your condition could worsen suddenly, putting yourself and others in danger. Stay put and wait for help to arrive. Number 4. Take aspirin if available. While waiting for emergency responders, chew and swallow an aspirin if you have one available and are not allergic. Aspirin can help thin your blood and improve blood flow to your heart, which might minimize damage during a heart attack. Use a standard, uncoated aspirin, ideally at a dose of 325 milligrams, but even a baby aspirin, about 81 milligrams, can help. Chewing it allows it to work faster because it enters your bloodstream more quickly. If you don't have aspirin on hand, don't worry and waste precious time searching for aspirin. Number 5. Position yourself correctly. Positioning your body correctly can also make a difference here. Sit down in a comfortable position, preferably on the floor with your back supported against a wall or couch. This prevents you from falling or injuring yourself further if you lose consciousness. Avoid lying completely flat, as this can make it harder to breathe. Sitting upright helps reduce the strain on your heart and keeps your airways open. If you're experiencing shortness of breath, try propping yourself up slightly with cushions to make breathing easier. Number 6. Loosen tight clothing. After positioning yourself, loosen any tight clothing around your neck, chest, or waist. This includes ties, belts, or snug collars. Tight clothing can restrict blood flow and make it harder for your chest to expand as you breathe. Freeing up these areas ensures that your body can circulate oxygen more effectively, which is crucial during a heart attack. Before we continue, if you're finding this information helpful so far, make sure to hit that like button and share this video with friends or family who might need to know these life-saving steps. Number 7. Focus on slow and deep breathing. This is a very important step. Short, shallow breaths can make you feel more panicked and reduce oxygen flow to your body. Instead, aim for slow, deep breaths. Count to 4 as you inhale through your nose. Hold your breath for a moment and then exhale for a count of 4 through your mouth. This technique, often used in stress management, can help you stay calm and keep oxygen circulating efficiently. Number 8. Massage your chest gently. If you suspect your heart attack is caused by a blocked artery, your body might benefit from increased circulation. While this is not a substitute for medical treatment, gently massaging your chest area can help alleviate some discomfort. Use light, circular motions around your chest, avoiding any aggressive pressure. This might help relieve tension and make it easier to breathe while you wait for professional help. Number 9. Do not attempt cough CPR. You may have heard of cough CPR as a potential method to survive a heart attack when alone, but it's important to know that this technique is not recommended for untrained individuals or as a standard practice. Cough CPR involves forcefully coughing repeatedly to maintain blood flow during certain cardiac events. However, it's only applicable in specific, monitored scenarios under medical supervision. Attempting it without guidance can lead to additional strain on your heart and might worsen your condition. Instead, focus on the proven steps we talked about earlier, like staying calm, calling for help, and positioning yourself correctly to maximize your chances of survival. Number 10. Avoid foods and drinks. It's essential to avoid consuming anything while experiencing a heart attack. This is because during a heart attack, you have a high chance of vomiting, so you may choke on the vomit. Stick to very small sips of water, only if absolutely necessary to take aspirin, but avoid solid foods or sugary beverages until medical professionals advise otherwise. Number 11. Try to stay awake. One of the scariest aspects of having a heart attack alone is the possibility of losing consciousness. If you start to feel faint or notice your vision narrowing, it's crucial to try to stay awake and alert. Talking to yourself out loud can help keep your brain engaged and focused. Repeat phrases like "help is on the way" or describe what you're feeling. This might sound odd, but it can ground you and prevent you from giving in to the sensation of passing out. How to prevent future heart attacks. While knowing how to survive a heart attack alone is crucial, preventing one is even better. Here's a step-by-step guide. Number 1. Exercise regularly. Incorporate at least 30 minutes of moderate exercise, such as brisk walking, cycling, or swimming, 5 times a week. If you're new to exercise, start with 10-minute walks and gradually increase the duration and intensity. Always consult your doctor before starting any new workout regimen. Number 2. Adopt a heart-healthy diet. Your daily sodium intake should stay under 2,300 milligrams, about 1 teaspoon of salt. Focus on the Mediterranean diet pattern. 7 to 8 servings of fruits and vegetables daily, whole grains making up at least half your grain intake, and fatty fish like salmon or mackerel twice a week. Limit red meat to once or twice a week and stick to portions no larger than a deck of cards. Include olive oil as your primary fat source, aiming for 2 to 3 tablespoons daily. Number 3. Manage your blood pressure. Try to check your blood pressure at least twice monthly. The ideal reading should be less than 120 over 80 millimeters of mercury. If you're on blood pressure medication, take it at the same time each day. Keep a blood pressure log with dates, times, and readings to show your doctor. Number 4, regular checkups. Schedule visits with your doctor every 6 months or as recommended to monitor your heart health. These checkups should include blood pressure, cholesterol, and blood sugar tests. Ask your doctor about tests like an EKG or a stress test to evaluate your heart's condition further. At the end, surviving a heart attack when you're alone is no small feat, but with the right knowledge and mindset, you can increase your chances of making it through. Remember, the key is to act quickly, stay calm, and focus on each step you need to take. By being prepared and aware, you can give yourself the best possible chance of survival. Now, we want to hear from you. Have you or someone you know ever experienced a heart attack? What steps did you take, and what advice would you give others in similar situations? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.